let's begin. So first question is, which rhombomere is associated with branchial arch 1? Any idea? So the options are rhombomere 1, rhombomere 2, rhombomere 3 and rhombomere 1 and 2. So let's move to the discussion part. According to this article, the rhombomeres and their relationship to the pharyngeal arches mentioned here. Here, this is the hindbrain. It has 8 distinct segments. They are called the rhombomeres. And these rhombomeres, which give rise to the motor nuclei to the cranial nerves 4, 5, 6, 7, 9, 10, 11 and 12. And also the neural crest cells to the pharyngeal arches. Okay. So rhombomeres also gives rise to neural crest cells to populate the specific pharyngeal arches. Which are these rhombomeres? Rhombomere R1, R2, R3, R4, R5, R6, R7 and RH. So there are 8 rhombomeres. And this R1 and R2 which forms the pharyngeal arch number 1. So this is the pharyngeal arch number 1. Okay. Then R4, it gives rise to pharyngeal arch number 2. And R6 and R7 to the pharyngeal arches number 3 to 6. Okay. So R3 and R5 do not participate in the cell migration. So R1 and R2 together forms the P1, that is pharyngeal arch number 1, and R4 leads to P2, and R6 and R7 leads to 3 to 6. Coming to the answer part. So what is the answer? It is rhombomere 1 and 2. Okay. So if it's asked for branchial arch number 2, then the answer will be rhombomere number 4. And if it is asked for branchial arch 3 to 6, then it is the rhombomeres 6 and 7. Okay. So what is about next question? It is salpingopharyngeus. It's innervated by which cranial nerve? Cranial nerve number 7 or 8 or 9 or 10. From this, you have to identify which muscle is this. This is the muscle of pharynx. So let's discuss about brief on muscles of pharynx. So muscles of pharynx are 3 constrictor muscles and 3 longitudinal muscles. Okay. So 3 constrictor muscles are superior constrictor, middle constrictor and inferior constrictor. And 3 longitudinal muscles are stylopharyngeus, palatopharyngeus and salpingopharyngeus. So here you have to know what is the innovation for the muscles of pharynx. So all the muscles of pharynx except stylopharyngeus is innervated by the vagus nerve. But stylopharyngeus is innervated by glossopharyngeal nerve. Okay, so salpingopharyngeus, palatopharyngeus is innervated by vagus nerve and stylopharyngeus is innervated by glossopharyngeal nerve. So salpingopharyngeus is innervated by vagus nerve. Okay. And the stylopharyngeus is innervated by, you already know, yes, it is ninth cranial nerve, that is glossopharyngeal nerve. Okay, yes. So briefly on the cranial nerves. Okay, so here I have a mnemonic to remember the cranial nerves. So it is first cranial nerve, it is olfactory. Second one is optic. Third is oculomotor. Fourth one is trochlea. Then trigeminal, abducens, facial nerve, vestibulocochlear nerve or auditory nerve, glossopharyngeal, vagus, accessory nerve and hypoglossal nerve. So these are the 12 cranial nerves. So which should be remembered. This is very, very important. Here it is important. It is the mnemonic is Utafagua. Utafagua. So this is the mnemonic for remembering the cranial nerves. So first one is the olfactory nerve, then optic, then oculomotor, then trochlea, then trigeminal, then abducens, then facial, then auditory, glossopharyngeal, vagus, accessory spinal, and hypoglossal nerve. So these are the various cranial nerves. It's very, very important. Okay. So how many cranial nerves are there? 12 cranial nerves. Which are they? Olfactory, optic, oculomotor, trochlea, trigeminal, abducens, facial nerve, auditory nerve, glossopharyngeal, vagus, accessory spinal, and hypoglossal nerve. So these are the various cranial nerves. Okay. So coming to the next question, medial rectus is supplied by. Is it cranial nerve number 6 or 4 or 3 or 5? Okay. So let's brief on eye muscles. These are the eye muscles. Here this is the external muscles. Okay. Which are the muscles? Superior oblique, superior rectus, medial rectus, lateral rectus, inferior rectus, and inferior oblique. So which are they? Superior oblique, superior rectus. So oblique muscles are superior oblique and inferior oblique. Which are the rectus muscles? Superior, medial, lateral, and inferior. So there are 6 muscles. So its innovation is also important. There is one more mnemonic, that is SO4, LR6, AO3. So this is the mnemonic for extraocular muscles. So what is SO? It is superior oblique. If it's superior oblique, then it is innervated by fourth nerve. Which is the fourth nerve? According to Utafagua, yes, it is trochlea. So trochlea nerve is the fourth nerve. So this one, that is superior oblique, is innervated by fourth cranial nerve, that is trochlea nerve. Okay. Then second one is the LR6. What is LR? That is lateral rectus. Okay. So lateral rectus is supplied by sixth cranial nerve. Which is the sixth cranial nerve? So according to Utafagua, yes. 1, 2, 3, 4. Oh my gosh. So what is the answer? Medial rectus is supplied by third cranial nerve. Which is the third cranial nerve? Yes, it is oculomotor. Okay. Then lateral rectus is supplied by sixth cranial nerve, that is abducens. Superior oblique is supplied by fourth cranial nerve, that is trochlea. Okay. And also levator palpebrae superioris, it's also a muscle which supplies by oculomotor. Okay. But this is a muscle of facial expression. That is the levator palpebrae superioris. So muscles of facial expression except levator palpebrae superioris is supplied by the facial nerve. Which is the facial nerve? Yeah, it is seventh nerve. Okay. So coming to the next question, which is the first branch of external carotid artery? So the options are superficial temporal artery, ascending pharyngeal artery, lingual artery, and facial artery. So coming to discussion part. So which are the parts of external carotid artery? It is ascending pharyngeal artery, superior thyroid, lingual, facial, posterior auricular and occipital, then superficial temporal and maxillary. So these are the various parts of external carotid artery. So this is the first part, that is ascending pharyngeal artery. And also this is the first part, and also it is a medial branch of the external carotid artery. Then these are the anterior branches. This is the medial branch or first branch. Then these are the anterior branches, that is facial, lingual, and superior thyroid arteries. Then these are the posterior branches. Which are the posterior branches? Occipital and posterior auricular arteries. Then the superficial temporal and maxillary are the terminal branches of external carotid artery. So these are very, very important. Okay. So which is the very first branch of external carotid artery? It is ascending pharyngeal artery. Then, which is a multi-pennate muscle? Temporalis, rectus femoris, deltoid, tibialis, anterior. So coming to the structure of some skeletal muscles. So these are the some of the structure of skeletal muscles. This is the abdominal muscles which are parallel. Then biceps brachii, which is fusiform. Digital extensor is unipennate. Then rectus femoris, it is bipennate. Then this is the deltoid muscle. This is multipennate arrangement. And this is the pectoralis, that is convergent arrangement. So, and also this is the circular muscle. It is seen in orbicularis ocularis. So this is a deltoid muscle. It is a multipennate muscle. It involves multiple rows of muscle fibers whose central tendon which branches into two or more tendons. So the deltoid, which is the largest muscle, and that lies over the shoulder joint. Okay, and it is an example of multipennate muscle. And it can be broken down into anterior deltoid, lateral deltoid, and posterior deltoid. So this is the multipennate muscle which is seen in deltoid muscles. Okay. So which is a multipennate muscle? It is deltoid muscle. And what about the other options? What is temporalis? It is triangular arrangement. Okay. And we have all seen that rectus femoris. What is that arrangement? It is bipennate arrangement. And tibialis anterior, it is circumpennate arrangement. So these are the various structure of skeletal muscles. Okay, it's clear? Yes. So next question is the second bone to ossify in the body is clavicle, humerus, mandible, or radius. So the clavicle is the first bone to ossify in the developing embryo. So clavicle is the first bone to ossify. At approximately 5 weeks of gestation, primary ossification of clavicle proceeds by membranous ossification of two centers with no prior cartilaginous primordium, and both will soon fuse. And the mandible is the second bone in the body after clavicle to commence ossification. So which is the second bone commence ossification? It is mandible. First bone is clavicle. So these are the two questions related. Okay, related to each other. Okay. So the second bone to ossify in the body is mandible. Next question. Foramen scarpa is another name for. Is it incisive foramen or greater palatine or lesser palatine or sinopalatine foramen? So it's a direct question. So it's a direct question and the answer is incisive foramen. If the options there is a nexopalatine foramen, then it is also correct. So next question is which muscle has dual nerve supply? So the options are masseter, temporalis, lateral pterygoid, or digastric. So just look into it. Yeah, this is the picture showing digastric muscle. Here it is the anterior belly of digastric and this is the posterior belly of digastric. Okay, so these are the anterior belly and this is the posterior belly. So what is this term implies? Here there are two bellies, that is anterior belly and posterior belly, that is digastric muscle. Okay, and it is a bilaterally paired suprahyoid muscle located under the jaw. So it is a suprahyoid muscle. Its posterior belly is attached to the mastoid notch of temporal bone. This is the mastoid notch and this is the mastoid notch of temporal bone. Here the posterior belly is attached. Okay. Then anterior belly is attached to the digastric fossa of the mandible. This is the mandible and this is the digastric fossa. So the two bellies are united by an intermediate tendon which is held in a loop that attaches to the hyoid bone. This is the intermediate tendon. Anterior belly is innervated via the mandibular nerve. So anterior belly, it is innervated by mandibular nerve and the posterior belly is innervated by the facial nerve. Facial nerve, it is 7th cranial nerve and mandibular nerve, it is 5th cranial nerve. Okay, so Posterior belly is innervated by facial nerve and it is derived from the second pharyngeal arch. And anterior belly is derived from the, it is innervated by mandibular nerve and it is innervated from, it is raised from the first branchial arch. Okay, so anterior is first and posterior it is second. So term digastric muscle refers to this specific muscle even though there are other muscles in the body to feature two bellies. So it may act to depress the mandible or elevate the hyoid bone. Okay, so the answer is digastric muscle. It has dual nerve supply, anterior belly, mandibular nerve and posterior belly facial. Coming to the next question, it is inferior parathyroid gland is derived from which pharyngeal pouch? So there are pharyngeal pouches and also there are pharyngeal arches. Is it first or second or third or fourth? So coming to the some derivatives of endodermal pouches or pharyngeal pouches. So first pouch, it gives rise to pharyngotympanic or auditory tube, then middle ear cavity and tympanic antrum. So these are from the first pouch. Then second pouch, it is ventral part of pouch is gives rise to tonsil and dorsal part gives rise to tubotympanic process. Then third pouch, it is thymus and inferior parathyroid. But a fourth pouch gives rise to superior parathyroid glands. And fifth pouch, it is known as ultimobranchial pouch. It is incorporated into the fourth pouch and forms caudal pharyngeal complex. This gives origin to the parafollicular cells of thyroid gland. So these are the various derivatives of pharyngeal pouch. Okay. So what is the answer? Inferior parathyroid is derived from third pharyngeal pouch. And the superior parathyroid is derived from, it is a direct question, fourth pharyngeal pouch. So all clear? So that is all for the today's episode. Stay tuned for the next video. Please do subscribe for more videos. And if you like it, then you press like and share to your friends. Thanks for watching.